Hello there, my name is Paul Rice and I'm one of the advanced clinical practitioners. And today I'm going to be showing you a short video on the setting up and the replenishment of a subcut pump. Okay, first of all, I would always recommend get a sterile pack so that you put out all the equipment that you need for this procedure in one place at one time, so that you're not hunting for stuff and then perhaps you haven't got it and it's too late into the procedure that you find out. So get it all laid out in an orderly manner, and this is an example of the stuff that you need. You need your pump, and you need to check that it's in date regarding its service, and you will check that by looking at the label on the side of the pump there. The pump will always have a case, which we have got just there, with a key. Always keep the key and the case together. You will need a sharp spin for all your sharps to hand. You will need a battery. Always use a Duracell battery. They are the preferred make of battery to be used by our organisation. You will need a clinical wipe, and the clinical wipe is for the skin prep when we put it in the subcut site. You will need a SAPT intima device, which is a subcut device that we use to deliver the meds to the patient. And you will need what we call an extension line, which attaches to that SAPT device and then attaches to the pump. Both the SAPT and the extension lead will be needed to be changed regularly once they're on the patient, and I'll come on to that later on. You will need either a 20 ml Luer lock syringe, and by Luer lock, I mean the Luer lock on the end there, not a slip syringe. Or you will need a 30 ml Luer lock syringe, dependent on how much solution volume you've got. And we'll come on to that again later on. You will need individual syringes for drawing up all the medicines that you wish to put in your pump for the symptom control, because all ampoules, or mostly all ampoules, will be overfilled. So if you just pull a 10 milligram in a ml, for example, ampoule into a syringe, you will usually get a little bit more than a ml, which means it's more than 10 milligrams. So just be mindful of that. You will have a selection of filter needles and non-filter needles. And the filter needles will have a little purple edge top there, and they will filter any shrapnels of glass that you've got from your glass ampoules. Okay, so it's very important that after you've drawn up from the ampoule, that you then change to a non-filter drawing up needle. Okay, so that you're not then distributing those shrapnels into your solution. Okay, you will need a film dressing like the one I've got here, and this is so when the SAPT intima is on the patient's skin, if there's any irritation, any precipitation at the site and redness, you can see through the film dressing, so not to put an occlusive dressing over the top that you can't see the site. Importantly, you will need a drugs added to this infusion label, like the one I've got there. This is really important because you need to have the patient's name on it, the patient's NHS number, you need the date the solution was prepared and the date it's due to expire, and you add in all the drugs that you've got in your pump. And then you'll always put this onto the syringe after you've prepared it. And this is then, so if someone's admitted into secondary care or to the hospice, or if somebody goes in and there's any uncertainty of what's in the solution pump, then it will be written on this label for clarity. If you don't have one of these posh labels, improvisation will do. Just an ordinary sticky label can be used as long as there's written information on that syringe. Okay, so that's the equipment that we need for the setting up of the pump. So always keep it sterile and as clean as possible. So now I'm going to put my gloves on. I haven't washed my hands and sanitized my hands. Put my gloves on and prepare my solution. Okay, so today for the purpose of this video, I'm going to be using morphine sulfate, 10 milligrams in a ml. So I'm only going to be using one medicine. So I look at my ampoules and I check what I got. So I will have a solution, dilutant, to draw up to the full volume in the syringe. So this will have to be written up on the community palliative care drug chart. And there's a preferred either water for injections or sodium chloride. So do check what the doctor or the nurse practitioner has prescribed. I will then check my medicine, and for video purposes and training purposes, I'm going to use this ampoule as my 10 milligrams in a ml. Okay. So when I check the dates and I check that everything is okay, I can start setting up. These are very useful ampoule snappers for glass ampoules to use, as they stop any sharps going into your hand. Nice clean break there with these ampoules. Yeah. Okay, so everything's ready. If you've got a lot of drugs, I would always recommend laying everything out and putting your drugs after you've drawn them up separate so you know which is which. Okay, right. So I am going to draw up with my filter syringe 10 milligrams in a ml of morphine. There we go. Checking that I don't lose any of it. That's it. So if you don't rush, then you've got less chance. And another little tip, if you do overfill your syringe, always put it back in the ampoule as carefully as possible, because what you don't want to do is squirt it into your sharp bin, which is what I've seen people do, and then you might need it later on if there's any loss of medicine. Okay, so there's my 1 ml, and I'm going to put that there so I know that that's my morphine sulfate. Okay, so this is my sterile peel, so I can pop that down just there a second and get my new non-filter needle to go on the end of my syringe. Okay, so that's drawn up regularly. Now, because I'm only using one medicine, I'm going to use my 20 ml syringe. And for a 20 ml syringe, you draw up to 17 mils. Okay. Now, if you're going to use 3 or 4 different medicines, I would always suggest the 30 ml syringe. Again, BD plaster pack, and we draw that up to 22 mils. Okay. And checking again that it's Luer lock and it's not Luer slip. Okay. So because I've got one medicine, I'm going to use my 20 ml syringe. So I'm now going to decant my morphine into my 20 ml syringe. Okay, like so. And there we have it. Okay. So I'm now going to put my filter needle onto the end of my syringe, and because it's 20 mils, I am going to draw up to 17. Very, very slowly, because what I don't want to do is go past the 17 mils. There we go. This one. There we go. Like I say, do it slowly, there's no rush, we don't want to lose any of our medicines. There we go. And then up to 17. There we go. A little tiny bit more. Lovely. And I've got 17 mils of solution. Okay. So what I'm going to do now is I'm going to take off my needle, and I'm going to just pop this on the end of my giving set for a minute. So I've got it safe and kept clean. I'm not going to lose any of my solution there. I've got no sharp risk either. Okay. So what we do next is we fill out our form. clearly and pop it on the syringe. And as you pop it on, making sure that you're not covering any of the information on that syringe, so we can see clearly that it's a BD plaster pack and the numbers at the side. Okay, just pop it on like that. Excellent. So tune in then to our syringe pump. We are going to pop the battery in, like so, and turn the pump on by pressing the on switch. Now, as you will see, the arm of the plunger will go back and sit nicely into our starting point. This doesn't always happen if someone turns off the pump by taking the battery out mid-cycle, if someone's passed away or we're stopping the pump. So it's always better to do it properly so it doesn't come discalibrated. Okay, so it's settled nicely to where it should be. So I'm going to be popping my syringe, full syringe, onto my pump safely. If you find a nice flat surface so you can line it up, and that's a good idea. Pop it onto the surface and keep moving that plunger forward until it fits in nicely, which is just done. Now this is called load and prime, and this is a chosen way we do it in this organisation at this given time. It'll all come a bit more clear now. So there'll be a series of messages now, and it's actually asking me to pump 20 ml BD plaster pack, and I want to confirm that by saying yes. And the volume is 16.7 mils over 24 hours at 0.70 mils per hour, and I want to press yes. Okay, I don't want to start my infusion. What I'm now going to do is, because I'm setting up the pump, I'm going to take off the syringe. Okay, and I'm going to prime my line, because obviously we've only got airspace in there at the moment. So gently push in and watching as you go all the way along until we get to the end, and you see a little bubble right on the end. You probably can't see on the video, but it's just there. Beautiful. Last little push. And a steady hand, because you don't want to lose any of your medicines. And there it is. What I now do is I put that little stopper back on to protect that end. I'm now going to return my syringe to the pump. And again, move the arrow along until it sits in nicely, using a flat surface just to slot in gently and bring the lever across. Okay. Now, it's asking me the series of questions again. 20 ml BT plaster pack, yes. Now it's going to say now, press yes to resume or no for new syringe. Well, we're going to want to resume, but not quite yes. So we're going to go yes. 15.8, now the duration is 22:43, so we know we have to go back earlier tomorrow to replenish the pump. Okay, so I'm now going to set that aside, and I now want to go and take all my equipment that I need for attaching to the patient So, using my chlorhexidine alcohol wipe, after I've gained consent from the patient and discussed the procedure with them and the chosen site, I will wipe the chosen site with a chlorhexidine wipe, which is 2% chlorhexidine and 70% alcohol. You can use the deltoids, you can use the thighs, you can use the abdomen. Have a good look at the chosen site. It might be that someone's got ascites, so the abdomen wouldn't be such a good choice. People might have some lymphedema on their thighs, so you wouldn't actually be getting your dose. So have a really good look before you choose a site. But if all okay, the best site would be the upper deltoid. So wipe. You then take your sachet intima, and if you look carefully, it's got grip at that side, and that will lead you to prompt you at which side that should sit next to the skin, okay? And it will be bevel down. You take the sheath off the end of your sachet and you deliver it into the patient at 45 degrees. Okay. Now for training purposes, I'm going to show that that's on there in the patient, okay, and that you just take the end off and pull, and the sharp comes off and it's gone. Okay, that then attaches very nicely to the extension line. Now the needles can stay in for 7 days. I'll just stop that because he's telling me to get move on. The needles can stay in for 7 days as long as the subcut site is clean and healthy, and that will be documented on our charts, which I'll show you in a moment. And the lines can stay for 3 days. However, if tomorrow when I come back, I'm going to change the medicines in the line or make some adjustment doses or add another drug in, that line will need to be changed. But bear in mind that every time you change the line, you have to go back an hour earlier the following day because you're losing an hour. Okay. Right, so that's safely into the patient and we're all lined up. So it's now saying to me, I've got the safety on the end of it, so I can show you. 15.8 mils over 22 hours and 43 minutes. So I'm going to say yes. It's asking me now, do I want to start the infusion? Yes. And it's telling me that the time remain is 22 hours 43 minutes and it's a rate of 0.7 mils per hour. It's also telling me that the pump is delivering and we're using 20 ml BT plaster pack syringe. Just here, you've got the on and off switch. When you see a little light, a green light will be flashing to tell you that the pump is delivering and there's no problem. Should it flash red, always say to carers and patients, it will start alarming to contact the SPA and ask for one of the nurses to attend to see what's causing the problem that it's not delivering. Okay. If you press the info button, we can now lock the front and the lock is on. And this is a really useful button because if you press it once, it will tell you the battery level, 99%. It will tell you the infusion summary, the volume to be infused and the volume already infused. And it will tell you that it's locked. All right. Now with the batteries, if you've got a battery of anything less than 35%, change your battery. So I would say if I'd gone for a reset today and my battery was saying 40, I would change it. You don't want your battery running out at any time during the infusion process and your patient not getting the symptom control that they need. All right. So yeah, so that's the setting up of the subcut pump. And the important part now is documentation. So what you have to think is you want to, for the person who's following you in, to be aware of what you've done, and obviously it should be put on EMIS as well, full report. But this is the subcut pump sheet for maintenance. So with this sheet, it should clearly state the patient's name, date of birth, and NHS number. And if you follow all the way along here, you'll have a good outcome of clarity to the person that's going in after you, so they can see exactly what's in the pump, when it's due, when the lines are due, and when the sub-T-intim is due for a change. Okay. Bearing in mind, we should always keep a record, a clear, concise record of our controlled drugs, and this should be done on this form, so that will help knowing whether we need to re-order with a prescription with the GP, or whether, in the odd case, that there might be some CDs missing. The CDs can be kept if you've got any concerns in a, whether they might go missing, because it can happen, in a blue bag. All right, and this is a clearly locked bag with a little tag that you can secure your CDs in if you've got any problems at all. And the CDs in this bag should tally with that chart. Okay. The community palliative care drug chart. This is the chart that we use in the community for setting up our pumps and giving staff doses. During the COVID period at the moment, this can come off the internet and the email address will be the only signature that you need. However, if you have got a hard copy, you will need to ensure that the GP signs quite clearly their name and what clinic they're from on the front there, whether they're out of hours deputising service. And you need to make sure that you yourself, as the setting up of the pump, will need to put your name and designation quite clearly on the front there. These charts can come sometimes, as I've mentioned before, come as a print off or a hard copy. Any problems with them, any concerns with the staff doses, if the GP hasn't signed properly or it's unclear, do not proceed with the setting up of the pump. Always seek advice to make sure that it's a safe procedure. Okay, so yes, I hope that's been helpful. If you've got any problems at all with anything during this procedure, seek help from the senior nurse or the ACP and guidance to make sure that it's safe at all times. Okay, thank you very much.